Good morning and welcome. To our audience today, we wanted to make sure that we're just letting you know that the information provided is general in nature, based on the current evidence, and that every person's situation is different. We suggest that if you have any concerns that you should seek individual advice from an appropriate healthcare professional. Good morning, my name is Simone Dullaway. My colleagues Jane Williamson, Danica Jandra-Smith and I work for the Chronic Disease Brisbane South team, which is part of Queensland Health. We've been asked to speak to you about cognition and motor neuron disease. We'll be covering a number of topics today, including the brain, what is cognition and what does this term mean, what cognitive changes you may see when you have motor neuron disease. We'll discuss in more detail what frontotemporal dementia is and what to do if your cognition is changing and what strategies you might find helpful. I'll also show some useful resources towards the end of the presentation. So let's start with what is cognition. Cognition, the word, dates back to the 15th century, where it meant thinking and awareness. Simply put, cognition is thinking, and we use our cognition in what we describe as executive functioning in daily life. Attention is your ability to stay focused and concentrate. This allows you to do tasks like watch a movie and keep track of what is happening. Your ability to pay attention affects how well you remember information. Your memory works best when you pay attention and don't get easily distracted. Organisation and planning skills are seen when you're arranging how to do things like get to a doctor's appointment. For example, getting yourself ready, working out what time you need to leave, where you need to park, and what questions you want to ask the doctor. Problem-solving skills help you work out what to do if you have a leaking tap, for instance, such as who do you call and how would you deal with the situation. Flexibility is the ability to adjust your thinking to switch between different tasks, for example, swapping backwards and forwards between tasks while cooking dinner and watching the news. Cognition also includes how you perceive and understand what you see, hear, and say. Our thinking ability impacts on how we behave. The two work together. It is important to highlight that many people with motor neuron disease do not experience cognitive and behavioural changes. There is a wide spectrum of changes in cognition in motor neuron disease. Some people experience very mild changes which are barely noticeable, whereas for others the changes can be more pronounced and obvious. Over 50% of people with MND can experience reduced abilities in thinking and behaviour. A small proportion, 5 to 15%, will show more significant changes and may be diagnosed with motor neuron disease with frontotemporal dementia or MND-FTD. Some people may show signs of dementia and later develop the motor symptoms. Some people with motor neuron disease do not notice cognitive changes until the later stages of their MND. Before I go on, I thought it would be helpful to acknowledge that you may feel a stigma associated with having a cognitive impairment, on top of having difficulty with maybe walking, breathing, and swallowing and talking because of your motor neuron disease. The thought that your brain may also change can be confronting. For friends and family, you may notice your loved one has changes to their behaviour and thinking, but lacks self-awareness or may become defensive if you approach the topic of their thinking with them. Hopefully today you'll have a greater understanding of cognitive changes to enable you to get the best care you may need. If you experience unusual changes to the way you think or behave, we recommend that you seek advice from your occupational therapist, psychologist, GP, or neurologist. Motor neuron disease is usually associated with muscle weakness and changes in breathing, swallowing, and talking. To understand how MND impacts on your cognition, I will talk about our anatomy briefly. Our brain is responsible for our ability to think. The brain is part of the nervous system. The brain and the spinal cord together make up the central nervous system. In our brains, there are approximately 80 billion nerve cells called neurons. These are referred to as upper motor neurons, and neurons talk to each other and form and communicate networks in our brain. There are also neurons in our peripheral nervous system, and these are the neurons that branch from our spinal cord to send messages to our muscles. These are the motor neurons that are damaged and result in weakness. In this picture, you can see an image of a motor neuron that is damaged by motor neuron disease, which then affects the ability for the muscle to work. This happens in the peripheral nervous system outside of your brain and spinal cord. When peripheral nervous system neurons are damaged, the ones that send messages to the muscles, our brain has the idea of what it wants to do, for example, pick up a pen. The brain sends the message from the central nervous system down the spine and out to the muscle. The message to the muscle is damaged, however, and the body can't do what it is being asked. The motor neurons that work in our brain or central nervous system can be damaged in a similar way to those that talk to our muscles. Damage to the neurons in the brain affects their ability to talk to each other, thus resulting in changes in our thinking ability. Inside the brain, there are different areas designed to specialise in different thinking abilities. When cognitive and behavioural changes occur in MND, it is because there have been changes in areas of the brain called the frontal and temporal lobes. The frontal lobe in red is responsible for smell, speech, concentration, planning and motor control. The temporal lobe in green works on hearing and facial recognition. The temporal lobe also helps with processing emotions, language and certain aspects of visual perception. Brain changes in motor neuron disease occur due to the damage to the neurons, along with other changes to the brain structure, so the white brain matter and the blood flow through within the brain. When we talk about changes to our cognition, this can be rather confusing due to the many different terms you may hear. So let's start with our first person. This is someone whose changes to their memory are considered normal as you get older. Our next person holding the mild cognitive impairment sign has changes that may involve problems with memory, language, attention, processing visual and spatial information, complex thinking functions, or problems in a combination of these areas. In mild cognitive impairment, these problems are less severe than those experienced by people with dementia. A person with a mild cognitive impairment may still have issues that worry them or their family. However, they can usually complete their daily activities such as cooking, cleaning and social outings. Then we have the umbrella, where people with a diagnosis of dementia sit. Our small person on the end is the little person with frontotemporal dementia. Of the types of dementia, the one most linked with MND is frontotemporal dementia, but this is a very small percentage of people. It is important to remember that whilst you have MND, some people may also have other medical conditions that have impacted on their brain's health, for example, alcohol use or a brain injury. When we talk about cognitive changes, there are often changes that we notice for people as they get older. We understand that not everyone with MND is older. If we digress for a minute, it's useful to talk about changes that are common for someone older and then those changes that might indicate a mild cognitive impairment but not a dementia. What is normal when you get older? It is considered typical to sometimes be forgetful but still be able to follow instructions, learn to use a new gadget, and remember how to do everyday things. Normal forgetfulness is walking into a room and forgetting what you went in there for, but then remembering. If you're worried about whether you're experiencing changes that are not normal, it is wise to ask your doctor for an assessment. Changes to your neurons because of your motor neuron disease may be impacting on your cognitive ability. However, it is important to remember that there are other factors, more lifestyle related, that can impact on a person's ability to think. Factors such as being unwell, hungry, stressed or depressed, tired, in pain, finding the environment distracting, having poor hearing or vision, drinking excessive alcohol, or being under the influence of medications may all impact on your ability to think at your best level. If you think about this scenario, you are tired and hungry, have a headache, and then have to drive home in the heavy traffic. On top of that, you have the radio blaring or noisy people in the car. Think about how your brain will be working in this situation. A diagnosis of MND is emotionally challenging, and changes to thinking and behaviour may often be mistaken for depression. It is important to ensure that the changes to your cognition are looked into, as some changes can be improved with the right management. Other medical conditions besides MND may also be impacting on your ability to think. MND may not be your only medical condition. We know that changes to our brain can occur for a number of other reasons, which are seen in people who have a family history of dementia, have smoked or used alcohol excessively, have high blood pressure, have sleep apnea, diabetes or mental health issues. Risk factors such as poor physical activity levels or lack of mental stimulation can also affect brain functioning. If you have been seriously unwell with an infection or something even as simple as a urinary tract infection, these can have an impact on your thinking ability. Weakening of breathing muscles caused by motor neuron disease may lead to inadequate breathing and cause a buildup of carbon dioxide in the blood. Raised carbon dioxide levels can cause changes in concentration, memory, and lead to confused thinking. It is important to really look at all your risk factors and work with your doctor to best manage your health and overall well-being. An assessment of your cognitive ability when you have motor neuron disease can be undertaken by a number of different health professionals: a neurologist, doctor, psychologist, neuropsychologist, psychiatrist, and so forth, as well as an occupational therapist, health professionals whom you may work with. An occupational therapist will look at your thinking ability in relation to how you manage everyday activities. There are also a number of pen and paper tests, some specifically designed for motor neuron disease, such as the Edinburgh Cognitive and Behavioural ALS screen, that can be completed. It is useful having a test if you are concerned. If you are having problems with your cognition or behaviour, having the correct diagnosis is key to management and treatment. Sometimes people will have an assessment undertaken, and the recommendations such as altering medication, dealing with stress and anxiety, and ensuring adequate nutrition or sleep will assist with improving cognition. If you are worried about your thinking, it is important to check out your brain's health, just like you would if you thought your swallowing was getting worse or your ability to walk. Having a diagnosis allows you to think about plans for the future and what support systems may be helpful for legal, financial, and personal decisions. A small number of people with motor neuron disease are affected by frontotemporal dementia. You may not be aware that you have changed if you are affected in this way. FTD mainly affects behaviour, thinking, and language. The MND Care website reported that in people with MND and frontotemporal impairment, they found a higher level of non-compliance with PEG feeding and use of NIV or non-invasive ventilation. They report that there needs to be ongoing research into the impact of cognitive impairment on the management of MND. So can cognitive or behavioural impairments be treated? There are no studies mentioned on the MND Care website that evaluate the use of medications to treat cognitive and behavioural impairments. One study found an improvement in cognition after non-invasive ventilation was commenced. In some people, neuropsychological and psychiatric services may be required to manage the implications of cognitive impairment. Changes in cognition can include difficulties with concentrating, thinking quickly, learning new things, recalling information from memory, reasoning and problem solving, planning and organising, and awareness and insight into the MND symptoms that you may have. Changes in behaviour or personality can include rigidity, which is resistance to changing routines or attempting new activities, impulsivity, so doing or saying things without considering the consequences, irritability, so experiencing a shorter fuse or reacting with disproportionate anger to events, disinhibition, difficulties in controlling behaviour or making social judgments, such as saying inappropriate things during social events, apathy, so reduced motivation and less interest in previously enjoyed activities, difficulty understanding and expressing emotions, for example, difficulty in picking up on emotional cues from others and responding appropriately. Frontotemporal dementia also includes changes in language ability. The person may show unusual speech patterns, writing or spelling ability may have changed, difficulty finding the right word in a conversation, or taking longer to respond in conversations. problems in understanding the meaning of words, and using odd words to get a message across. Repeating particular words or phrases over and over may also be seen. Emotional lability is a behavioural change that occurs in as many as half of all people living with MND, so not just linked with frontotemporal dementia. So what is emotional lability? It is known as pseudobulbar affect, and it can affect some people with MND. With this symptom, you may laugh or cry at inappropriate times, which may be distressing and difficult to stop. Seek advice from your GP or neurologist if you would like support to manage this symptom. So what can you do to optimise your thinking ability? There are many strategies that we could recommend. It is probably best to talk to your occupational therapist and work out what activities or daily events you have the most difficulty planning, remembering, or dealing with. A plan that meets your needs can then be developed. Simple strategies such as having a regular routine, keeping things in the same place all the time, so a memory place, and using things like your phone and technology to help you to remember may be useful. Using a Webster pack for your medication to limit medication errors may be a good strategy, and try to reduce the expectations on your brain, so do one thing at a time. You'll find many ideas on the internet that you may find helpful to you. The bottom line is, think of ways to make daily life less hard work on your brain. How can I maintain better focus? So keep in mind that your brain will work best when it has energy. So try doing important tasks when you're feeling most energized and you feel that you're able to focus the best. Try to do one thing at a time and reduce distractions in your environment. Take a break if you feel like you're unable to concentrate at the level that you need to. How can I manage my finances? If you are experiencing behavioural changes, you may find that you are more prone to spending money on things you don't need. You may find it harder to remember which bills need to be paid. So setting up strategies in advance, such as direct debit, can make it easier in the long run. What can I do to make appointments feel easier? It can be difficult to remember everything that your doctor or therapist may have said to you in an appointment. Ask the therapist or doctor to write down the key points that you need to remember, or think about taking somebody else with you so that they have also got the opportunity to remember the information. One aspect of daily life that can be impacted on by motor neuron disease is driving. The physical and cognitive changes associated with MND may prevent you from driving safely. The Department of Transport and Main Roads requires you to inform them if you have a permanent or long-term medical condition that will be impacting on your driving ability. You may require a medical certificate from your medical practitioner stipulating that you are allowed to drive. If you don't notify the Department of Transport of your permanent medical condition, you may receive a fine of $8,000 and your driver's licence may be cancelled. If you're concerned about your driving ability, please talk to your occupational therapist. You may need to take a driving assessment. Keep in mind that the person with the cognitive change is not being difficult, but there are changes in their brain that is impacting on their ability to understand, reason and problem solve. They often communicate at a feeling level that may not seem logical. They may not understand your concerns. When you are communicating with someone with cognitive changes, try talking in a calm and gentle manner. Keep sentences short and simple, focusing on one idea at a time. Allow time for them to understand what has been said. If behaviour or empathy are affected, they may be more aggressive. This can be upsetting for everyone involved, but it's not personal. Try to avoid arguing, as this will only make the situation worse. Don't order them around. Don't tell them what they can't do, instead suggest what they can do. Distract the person or change the subject and keep a safe distance and let the person calm down. It's also helpful to look at what situations you may find most challenging and think about those situations and if they can be avoided. For example, if your tolerance for crowds is reduced, then avoid grocery shopping on a Saturday morning. For the person with MND and their carer, there are a number of helplines that you can contact. The one listed on this slide is the National Dementia Helpline, which is open from Monday to Friday. This is a free helpline. It has translators for different languages or a national relay service for those with hearing or speech impairments. The Dementia Support Australia telephone line is open 24 hours a day. It is a free service that provides information and advice to people living with cognitive impairment and their family and friends. This service is for those people with a diagnosed dementia. The service provides advice and recommendations where behaviours are impacting the care of the person with dementia. You may find that your MND impacts on your behaviour and has changed the way you usually deal with a situation or behave around others. If this is bothering you, it is helpful to talk to a health professional. They can work on developing strategies that may assist. If you are a family member, it can be useful to identify and take note of times and situations where your loved one's behaviour has been challenging, and is there a link? For example, when they're tired and hungry, or after a long day. So how do I plan ahead for future care? We often recommend that you start now. Start early on in your journey. Talk to your social worker, and then consider using services such as the Advanced Care Planning Team, which you may have in your area. If you're not sure, then call the 1300 number. There are many resources available on the internet. The first one is from the MND Australia website, and it talks about cognitive and behaviour change in MND. The next is a resource from the Motor Neuron Disease Association in England, and it's a comprehensive guide written for health professionals, but is also useful if you'd like to know more information. I have ended this presentation with some interesting resources that you might find informative and helpful. The Dementia Australia website has some wonderful help sheets that talk about all types of different dementias and strategies for dealing with different types of behavioural problems that you may have. The ECAS website talks about the cognitive assessment in more detail, and I found that quite an interesting presentation to look at. Thank you for your time today, and I hope that the information provided has been helpful.
Thank you so much for that, Simone. I will unmute those of you that I did mute, but you might have to, I can only ask you all to unmute. So if you could unmute yourself, that would be fantastic. And then we'll see, does anyone have any questions?
Can these symptoms happen rapidly, changing cognition?
Can cognition change rapidly? Yes, it can. It really depends on, I guess, the course overall of your motor neuron disease. So for some people, they might see a physical change that happens rapidly, whereas for other people, they might see a cognitive change. So it's really variable. It's actually almost impossible to say how rapidly it occurs for some people, but we know some people from their diagnosis of MND might deteriorate very quickly, and within a space of 6 months go from having one symptom to multiple symptoms, whereas for other people they might just live for an extended period of time with one issue, such as motor loss in their legs, but everything else stays the same for a long period of time. Okay, so I guess if you're looking at rate of change with cognition, it's often useful to have an assessment done when somebody's first diagnosed with MND, a bit like you'd get the physio and they'll do all your muscle strength testing. Often it's useful to just get an idea about how people's memory and thinking is going to start with. And then if you feel like there's a change, then you can have reassessments done to track what's going on with that change. Okay, so if you're really concerned about it, by all means, you can have, some regular assessments done at regular intervals.
And that's a responsibility of the OT or the neurologist? Or?
A little bit of everybody. So, in terms of the practical everyday stuff and looking at memory and thinking ability, the OT can do that. We do a lot of different types of cognitive screening assessments with people. What we do is offer to do an assessment, and that information is taken to your doctor. Then your doctor kind of helps to put it all together to diagnose. Is this a depression impacting on cognition? Is this a mental health issue of another type? Is there other medical problems? Or if we look at the big picture, is this frontotemporal dementia to the MND? So their job as a doctor or neurologist is to actually diagnose what the cause of the cognitive impairment might be.
Excellent. And does that take a period of time? Like
it generally does do, yeah. Like if we were diagnosing a dementia in just any other person, like an older person, for instance, you'd often have an occupational therapist do an assessment. We might do a home visit and watch somebody do a functional task. We'd then have somebody visit a geriatrician and have some blood tests and some brain scans done, and all those types of things can help as well. You may not see all changes, you know, what are going on in the brain on a scan, and often the changes are very small but still have a functional impact. So you may not actually get a brain scan showing much, but when they've done, I guess, biopsies and MRIs on people to test how their brains are working, they can see that on somebody with MND and frontotemporal dementia, that some areas of the brain are just not firing and connecting when they're asked to do what they would typically be able to do. Does that help, Karen?
Yeah, it does.
All right. If in doubt, though, an assessment's a good starting point because it just helps to clarify what is happening. Is this an attention problem? Is this just a plain out the person doesn't want to listen to what the situation is problem and they're just, you know, not engaged? There's so many reasons why cognition can be impacted.
Okay.
Excellent. Thank you for that, Karen. Anyone else want to ask any questions? No?
No.
Oh, that must go to show just how thorough your presentation was, Simone. Thank you. Did you want to ask something, Andrew?
Look, it used to be, I thought in the past that when you got a motorised wheelchair, you were supposed to have a doctor's certificate saying you needed it and could safely use it. Obviously, some people with dementia can't safely use motorised wheelchairs, and
Yeah.
I guess it's a similar situation to driver's licenses then.
Yeah, look, I get what you're saying. Look, usually when we prescribe a motorised wheelchair, we'd want to make sure that you're safe at the first point. And then, of course, if your ability to change ability to drive safely has changed, though, then that's something to reconsider. And it would certainly mean like having a reassessment done to see how you're going. It really depends on the types of troubles that you might be having with your thinking. And you might not see that if you're just used to driving your chair around the house and, you know, it's a familiar place and you're not having to avoid people. And, you know, the complexity of driving just at home is going to be very different to driving on the road. Okay, there's no road rules in your own home and there's no, sort of legalities. You don't have a license to drive your powered chair, so it's not quite the same. But we'd still want to make sure that you're not at risk of running into walls or unsafely driving it if you were on a footpath, that type of stuff. Does that make sense?
Yeah.
Yeah.
Any other last questions? No?
No.
All right. Excellent. Well, thank you all so much for coming, and thank you especially to Simone for taking the time to put that presentation together. Like I said, it was really thorough, full of information and really useful. So thank you for that. Thank you for your time delivering it today and answering our questions.
No problem. Thank you.
All right. Well, bye everyone.